Hi, I'm Dr. Gunter, a board-certified women's health doctor with over 30 years of clinical experience, helping adults over 60 live stronger, more independent lives. Today, I want to address something that I believe is one of the most underdiscussed but critically important issues affecting older adults. Something that doesn't just impact comfort, but also independence, safety, and quality of life. I'm talking about leg cramps, muscle weakness, and that frustrating, wobbly, or unsteady feeling when you walk, stand up from a chair, or navigate stairs. This isn't just an inconvenience. It's something that can deeply affect your confidence, your sense of mobility, and your willingness to engage in everyday activities you once enjoyed. For many, these symptoms creep in slowly over time. At first, you might notice your legs feel a little heavy after a walk, or a little shaky after climbing stairs. Then one night, you're jolted awake by a sharp, sudden cramp in your calf or foot. The pain is intense and seems to come out of nowhere. You might even find yourself clutching your leg, trying to stretch it out in the dark, wondering what on earth is happening. And here's the thing, you're not alone. Millions of seniors experience these symptoms every day. It's far more common than you might think. But just because it's common doesn't mean it's normal or that it should be accepted as a routine part of aging. So let me ask you, have you ever woken up in the middle of the night with a cramp so sharp it brought tears to your eyes? Do your legs feel weaker than they used to? Like they don't quite have the strength to carry you through your day? Do long walks, stairs, or even standing at the kitchen counter sometimes feel harder than they should? Do you ever feel like you're just not as steady on your feet as you once were? If you said yes to any of these, this video is for you. Because contrary to what many people believe, these symptoms are not always caused by aging alone. In many cases, they're a red flag, an important message from your body saying, I'm not getting what I need. The good news? That's something you can address naturally and effectively. You see, over the decades I've spent working with patients, particularly those over the age of 60, I've come to understand just how profoundly nutrient status affects our muscles, nerves, and circulation. As we age, the body's ability to absorb and utilize certain key vitamins and minerals can decline. Medications, chronic conditions, and changes in appetite or digestion can make it harder to maintain the nutritional balance we once had effortlessly in our 30s or 40s. That means your legs might not just be tired, they might be undernourished. And when your legs are undernourished, they don't perform the way they should. The muscles become more prone to cramping. The circulation slows, making them feel heavy or cold. The nerves may not fire as efficiently, causing tingling, numbness, or instability. The strength you rely on for balance, walking, or even rising from a chair can start to fade. Not because you're not trying, but because your body is lacking the resources it needs to maintain that strength. That's why I want to share with you something that could be truly transformative. The top 3 essential vitamins that your legs need to stay strong, pain-free, and stable. These aren't exotic or hard-to-find substances. They're natural, safe, and well-researched nutrients that play critical roles in muscle function, nerve health, and blood flow. And when your body has enough of them, especially after years of going without, the results can be remarkable. We're talking about fewer nighttime cramps that rob you of sleep, more energy and endurance when you go for a walk or garden in your backyard, better balance when you're getting out of the car or stepping into the shower, and most of all, a renewed sense of confidence that your legs are supporting you, not holding you back. In fact, I've seen patients go from relying on handrails and walking sticks to navigating stairs with ease again. I've seen others who dreaded the idea of long walks begin taking daily strolls with their grandchildren. It all starts with identifying what the body is missing and giving it back. So in today's video, we'll break down those 3 essential nutrients, what they are, why they matter, how they work inside your body, and the best ways to make sure you're getting enough of them. We'll also talk about signs of deficiency, how to bring this up with your doctor, and safe supplement strategies that can help you get results without side effects. Because when it comes to aging, there's a big difference between getting older and getting weaker. And the truth is, we don't have to settle for feeling stiff, sore, or shaky. With the right information and support, your body can do far more than you think, even decades later. So if you've been feeling like your legs just aren't what they used to be, or you're tired of being woken up by painful spasms that leave you limping the next day, stay with me. I promise you'll walk away with real, actionable steps that can help your legs feel stronger, more stable, and more energized naturally and safely. Let's dive in. Vitamin number 1, magnesium, the muscle calmer. Let's start with one of the most powerful and overlooked minerals for leg health, magnesium. I like to call it the muscle calmer because that's exactly what it does inside your body. If you've ever had a sharp, sudden leg cramp that jolts you out of bed in the middle of the night, gripping pain that leaves you gasping and massaging your calf or foot, low magnesium could be the hidden cause. So what exactly is magnesium and why is it so important? Magnesium is an essential mineral that plays a role in over 300 different biochemical reactions in your body. That includes everything from blood sugar regulation, nerve function, and heart rhythm, all the way to muscle contraction and relaxation. In fact, magnesium helps regulate calcium and potassium levels in your muscles, which are two key players in the way muscles move and rest. But here's the catch. When you don't have enough magnesium, your muscles can become overstimulated. They tighten up too much, stay contracted too long, and that's when painful cramps occur. This is especially common during the night when your body is trying to rest, but your muscles haven't been given the signal to relax. And as we get older, this problem becomes more likely, not less. You see, magnesium absorption naturally declines with age. Even if you're eating a reasonably healthy diet, your body may not be absorbing magnesium as efficiently as it once did. Combine that with certain common medications like diuretics used for high blood pressure or heart conditions, acid-reducing drugs like proton pump inhibitors, and even some antibiotics, and your magnesium levels can quietly drop below what your muscles need. This leads to a cluster of symptoms that many older adults chalk up to just getting older, including frequent nighttime leg cramps, muscle tightness or stiffness when walking, restless legs that won't settle down at night, fatigue despite getting enough sleep, a general feeling of tension or unease in the legs. I can't tell you how many times a patient has come to me complaining about these exact symptoms, especially cramps, and no one has ever mentioned magnesium. It's often the missing piece of the puzzle. So what can you do? For most older adults, I recommend 200 to 400 milligrams of magnesium daily, ideally in the form of magnesium glycinate or magnesium citrate. These forms are much easier on the stomach than magnesium oxide, which is more likely to cause loose stools or digestive upset. They're also more bioavailable, which means your body can actually absorb and use them efficiently. You can take magnesium in the evening, often right after dinner or before bed. This not only helps replenish your stores, but also supports muscle relaxation as you wind down for the night. Many people even report sleeping better once they add magnesium to their routine. Now, here's something that surprises many of my patients. They often feel a difference within just 7 to 10 days. It starts subtly. You might notice that the cramps don't come quite as often, or when they do, they're less intense. Your legs may feel less jumpy at night. You might wake up feeling more refreshed because you're not being interrupted by sharp pain or muscle spasms. And then over time, those improvements build. Movement becomes smoother. Walking feels less stiff. Balance improves slightly because your muscles are more responsive. It's not magic, It's just your body finally getting what it needs to function properly. Of course, like with any supplement, it's important to be safe. Always talk to your doctor before starting magnesium, especially if you have kidney issues or are taking medications that affect electrolyte balance. While magnesium is generally safe for most people, high doses can interact with certain drugs or worsen pre-existing conditions in rare cases. Let me leave you with this. You don't have to accept painful leg cramps or stiff, heavy legs as your new normal. These are signs that your muscles are asking for help and giving them the right support. In this case, magnesium can make a remarkable difference in how you move, rest, and live. So if you're struggling with those sharp nighttime cramps or your legs just don't feel as relaxed as they used to, don't ignore it. Magnesium may be the gentle, natural muscle relaxer your body's been missing all along. Stay with me. Next, we'll explore another powerhouse vitamin that's essential for circulation and nerve strength in your legs. You won't want to miss it. Vitamin number 2, vitamin D3, the muscle activator. When most people think of vitamin D, they immediately associate it with bone health. And yes, it's true. Vitamin D plays a major role in helping your body absorb calcium, which keeps your bones strong and resilient. But what often gets overlooked is vitamin D's critical role in muscle function, especially as we age. In fact, I like to call vitamin D3 the muscle activator. That's because it helps your muscle fibers fire properly, stay responsive, and recover more efficiently after physical activity. Without enough vitamin D, your muscles can become sluggish, unstable, and weak, and that leads to problems with balance, coordination, and even safety. Why is this so important for adults over 60? As we get older, our natural production of vitamin D drops. This is due to several reasons. We spend less time outdoors, especially in colder months or during extreme heat. Our skin becomes less efficient at synthesizing vitamin D from sunlight. Many older adults use sunscreen daily, which blocks vitamin D production, or have limited sun exposure due to mobility issues. Darker skin tones naturally produce less vitamin D from sunlight, increasing the risk of deficiency. And even a healthy diet often doesn't provide enough vitamin D on its own. All of these factors combine to make vitamin D deficiency incredibly common in people over 60. And while it might not cause obvious symptoms right away, the effects on your muscles and stability can be profound. How does vitamin D affect muscle strength? Vitamin D works by binding to specific receptors in your muscle tissue. These receptors tell your muscles when and how to contract, coordinate, and stabilize you. Whether you're getting out of a chair, climbing stairs, stepping into a tub, or catching your balance after a misstep. When vitamin D levels are low, those messages get distorted. The result? You may notice a slower walking speed, shaky legs when standing or shifting weight, more difficulty with balance, especially in dim lighting, fatigue or heaviness in your legs, needing to use your arms to push up from a seated position, higher risk of falls, which can lead to fractures and hospitalizations. In fact, numerous studies have found that older adults with low vitamin D levels have significantly weaker lower body strength and are much more likely to experience falls than those with healthy levels. And because the effects are so gradual, many people don't even realize it's happening. They might simply say, "I'm just not as steady as I used to be," or "my legs don't move as fast anymore." But what I often find in my clinic is this. Once we test and correct their vitamin D levels, the change can be remarkable. So how much vitamin D3 should you take? I generally recommend 1,000 to 2,000 IU, international units, of vitamin D3 daily for most adults over 60. D3 is the active form of vitamin D, more effective than D2, and better absorbed by the body. Here's an important tip. Take it with food that contains some healthy fat. Vitamin D is a fat-soluble vitamin, which means it needs dietary fat to be properly absorbed into your bloodstream. Something as simple as a few nuts, a slice of avocado, or a bit of olive oil in your meal can make all the difference in how well your supplement works. In certain cases, especially for individuals with very low blood levels, higher doses may be needed temporarily, but this should always be done under medical supervision to avoid oversupplementation, which can cause issues with calcium levels. If you're not sure whether you're getting enough, ask your doctor for a simple blood test to check your vitamin D status. It's called a 25-hydroxy vitamin D test, and it can give you and your provider a clear picture of whether supplementation is needed and how much. The improvements can be life-changing. In my experience, once patients start taking the right amount of vitamin D3 consistently, we often see dramatic improvements in their walking speed, a leg strength, overall stability, confidence when moving. Even activities that used to feel risky, like walking on uneven ground, getting in and out of the car, or going up steps, start to feel easier and safer. And it's not just physical. When you feel strong and balanced, it affects your mental and emotional well-being too. I've had patients tell me they feel 10 years younger just from being able to move freely again without the constant fear of falling. Can you get enough from sunlight alone? In theory, yes, but in practice, not likely for most older adults. To make sufficient vitamin D from the sun, you'd need direct sunlight on your bare skin for about 15 to 30 minutes a day, depending on your location, skin tone, and the season. If you live in a northern climate, cover your skin regularly or spend most of your time indoors. You're almost certainly not making enough naturally. That's why supplementation is such an important part of protecting your muscle health as you age. If your legs have been feeling weak, unsteady, or just not as strong as they used to be, vitamin D3 may be the missing piece. It's one of the simplest, safest, and most effective ways to support your muscles from the inside out. And it can help restore the strength and stability that lets you move through life with confidence. Whether you're trying to avoid future falls, regain energy for daily activities, or just feel steadier on your feet, correcting a vitamin D deficiency can be a powerful first step. Coming up next, we'll look at a vitamin that's essential for your nerves and plays a big role in how your legs feel, move, and react. Stay tuned. Vitamin number 3, vitamin B12, the nerve restorer. If your legs ever feel numb, tingly, heavy, or like they've fallen asleep, you might be dealing with more than just poor circulation or muscle fatigue. These are classic signs of nerve dysfunction, and one of the most common and most overlooked causes of these symptoms is vitamin B12 deficiency. Vitamin B12 is absolutely essential for nerve health and communication. It helps produce the protective coating around your nerves, called myelin, which ensures that nerve signals travel efficiently from your brain to your muscles and back again. When B12 is low, that protective coating can break down, leading to misfiring signals, poor coordination, and numbness or weakness, especially in the legs and feet. Unfortunately, B12 deficiency becomes more common as we age. In fact, up to 20% of adults over 60 have low or borderline B12 levels, and many have no idea. That's because the symptoms can come on slowly and are often mistaken for just normal aging. So, why do B12 levels drop with age? One major reason is that our stomachs produce less stomach acid as we get older. Stomach acid is critical for separating B12 from food, so it can be absorbed in the small intestine. Without enough acid, even a diet rich in B12 may not provide what your body needs. In addition, common medications can worsen the problem. Drugs like metformin used for type 2 diabetes, proton pump inhibitors like omeprazole or pantoprazole, and H2 blockers like ranitidine or famotidine can interfere with B12 absorption. These medications are widely used and often taken for years, slowly depleting B12 levels over time. If your B12 is low, you might experience tingling or numbness in your legs, feet, or hands, a feeling of pins and needles or electrical zaps, leg heaviness or weakness when walking, poor balance or coordination, fatigue or brain fog. For many of my patients experiencing these symptoms, restoring B12 levels has made a world of difference. That's why I often recommend 1,000 micrograms mcg of methylcobalamin, a highly active and absorbable form of B12, taken daily for 1 to 3 months. Methylcobalamin is more readily used by the nervous system than other forms like cyanocobalamin, and it's especially helpful for rebuilding nerve pathways and restoring proper function. Many patients report that within a few weeks, they notice improved sensation in their legs and feet, better balance and walking confidence, reduced tingling, numbness, or weakness, a general sense of lightness and energy returning to their lower body. Of course, it's always best to check your B12 levels with a simple blood test before starting supplements. But if you're experiencing these symptoms and are in your 60s or beyond, B12 is absolutely worth exploring. Because when your nerves are healthy and responsive, your legs move with ease and you feel safer, steadier, and more in control. Now remember, supplements can help, but they should never replace a comprehensive health strategy. So if you're experiencing frequent leg cramps, sudden weakness, or trouble walking, always speak to your doctor first, especially if you're on medication. And for best results, combine these vitamins with daily stretching, gentle walks, and hydration. The body responds to care, and it's never too late to rebuild strength. If this video helped you, give it a thumbs up and share it with a friend or loved one over 60 who could benefit. And don't forget to subscribe for more science-backed wellness advice from me, Dr. Jen Gunter. Let me know in the comments, have you ever struggled with leg cramps or weakness? What helped you the most? Until next time, keep moving, keep nourishing, and never stop strengthening your body.